Well, hello, everyone. I'm Don Berwick, President Emeritus and Senior Fellow at the Institute for Healthcare Improvement, IHI. Well, I want to share some thoughts about the current and possible role of, of patients and families, especially in the shaping of the healthcare of the future. But I'm going to begin with a little bit of narrative, not about healthcare. So I stayed in a hotel recently. It wasn't easy. I called ahead for a reservation and ended up navigating a series of steps. Press one if you're calling from a landline, press two if you're a turtle, press three if your three button doesn't work, and so on and on and on. But after a long while, I reached a person. He put me on hold for a long while, and then he finally returned. And I said I needed a reservation for April 10th. Well, said the man, unfortunately, our next available reservation is July 22nd at 7 a.m. How does that work for you? I said, it doesn't work for me. I need a room on April 10th for my grandson's birthday. He said, but I told you our next available is July 22nd. Why don't you change your grandson's birthday? Well, we went back and forth a while like that. And then I said, oh, by the way, I forgot to mention that I have a super platinum frequent sleeper status with your hotel, and your manager is my second cousin. And he asked, and you speak fluent English? 100%, I said. He said, okay, let me look again. And he put me on hold. And then he came back with, okay, we can squeeze you in on June 22nd. I said, I need July 22nd. All right, he said, put me on hold, and then said, well, we can squeeze you in on July 22nd. You'll be sharing a room with a Mr. Jones, whose real name I can't tell you for privacy reasons. I said, sharing a room? I don't want to share, especially not with a stranger. He said, don't worry. The room has separate beds, and there's a lovely floppy pink cloth curtain between the rooms, between the beds. And you'll be dressed in a gown that looks like a bed sheet, and it almost covers your genitals. So Mr. Jones won't care. He'll be wearing the same thing. I said, I don't want to wear your gown. He said, well, can you imagine what this hotel would look like if everyone wore their own clothes? It would be chaos. No, I said, I need my own room, and my wife is going to be with me. Oh, no, he said, our rules limit your wife's time to 2 hours a day, and only when our cleaning staff aren't coming, and not before noon or after 8 p.m., and not between 2 and 3, because the cleaning staff will be signing out to each other. So I nearly shouted. I said, but it's my wife. We've been married for 47 years, and I need her help. And he said, kind of angrily, well, what do you think would happen if we let everybody's wife just come in whenever they wanted? It would be very inconvenient for our staff, and Mr. Jones might not like your wife. I said, well, yeah, I told you, I want my own room. No, Mr. Jones. He said, well, look, if you insist, there will be a surcharge. How big a surcharge, I asked. And he said, I don't know. And anyway, that's proprietary information. I said, well, how much is this whole thing going to cost me anyway? I asked. He said, I don't know. And anyway, that's proprietary information. And it depends on whether you're in the network or not, and whether your zip code is an even number or an odd number, and whether you're over 65, and whether you promise to use our restaurant, and whether you promise to behave yourself. You mean you won't tell me your prices? I said. He said, well, I don't know our prices. And anyway, if I did, I wouldn't tell you. I mean, can you imagine what would happen if everyone knew our prices? I mean, people might go shopping around for hotels, and how unseemly would that be? And anyway, when it comes to your hotel experience, isn't it truly priceless? Don't you respect what we do for you? And he seemed like he was close to tears. I said, well, that doesn't make any sense to me. Who owns your hotel anyway? He said, I don't know. And if I did, I wouldn't tell you. It's proprietary information. Between you and me, I think it might be a shell company of a holding company of a private equity firm in a joint venture with a hardware store chain. But trust me, they all put you, the customer, first. Well, I ended up staying at the hotel after all, and I got into my room after a 4-hour wait in the lobby holding area. I was hungry, and I went to the hotel restaurant, and there was a menu. It had two items: tuna on white bread and pasta bolognese. Which do you want? Asked the server. And by the way, why aren't you wearing your gown? And where is your barcode? I said, I really don't want either of those things. I said, I never eat white bread and I'm a vegetarian. The server said to me, well, what do you think this is? A hotel? Can you imagine what would happen if everyone here just ate what they wanted? And anyway, our manager says here that you have to eat the pasta. It's better for you. I don't want the pasta, I said, but he's the manager and you are not. Now think about it. Who do you think knows better? Do you want a reputation here for being non-compliant? I promise you it won't be pretty. As I left the hotel the next morning, it took me 2 hours to check out, and I decided to make a stop at the customer service desk. And I recounted my saga and I complained. And the clerk just looked at me and she said, do you have any idea how hard it is to run a hotel? Just be happy for what you got and have a good day. Well, enough of that. That's all a made-up story, of course, but I had fun writing that little tale. In fact, I could have gone on for pages and pages more. I was really on a roll, but you get the point. No hotel or restaurant would survive for long if it acted like that. And healthcare too often acts exactly like that every single day, or more accurately, it used to. Now, I want to soften that last statement. Definite progress is giving meaning to the term patient-centered care, person-centered care. Many examples of much more compassionate, flexible healthcare organizations are now exist and can be noted. The norms of behavior in healthcare are evolving, thank goodness. And the workforce, doctors, nurses, technicians, managers, often, I dare say usually, are working with real generosity and from their hearts. They want to heal others and they want to do the right thing. But in healthcare, even at their best, our clinicians find themselves too often trapped in a system of rules and habits and payment and architecture and frail infrastructures that keep them from accomplishing what really gives meaning to their lives. In my opinion, a little too close to that story of the fictitious hotel. And then patients and families downstream, they pay the price. They pay the price in frustration, in confusion, in delay, in errors, and in very high and increasing costs, including costs right out of their own pockets. And as is far often true in America still, in almost any domain, if your wallet is thin, or your first language is not English, or your skin is dark, the price you will pay will be the highest price. And that hotel skit won't sound so funny or so unfamiliar. Now, I don't think there's a single magic answer to the ongoing poor performance of American healthcare. Look, our healthcare system is rated 69th in the world, and we spend double the per capita costs of the next most costly systems. The next most costly system is in Switzerland, and they're rated number 2 in the world. We're number 69. Our infant mortality and lifespan are around 40th in the world. Black life expectancy lags white life expectancy across the United States by close to 7 years. And life expectancy varies by 16 years. From the Chicago Loop, relatively wealthy, to West Chicago, not wealthy at all. It varies by 15 years across Flint, Michigan. Life expectancy varies by over 25 years among the neighborhoods in my own city, Boston. In other words, there's a lot to fix, and success is going to require many, many changes in the ways we think and act and invest in healthcare and health. I've devoted my career and will continue to devote it to seeking those changes, and they're not few, they're many. But if you force me to name one lever, one most powerful lever, one change that would have the biggest potential for improving our nation's health and healthcare, here's what I would say: shift the power. Shift the power from the healthcare system that gives us the care we want and need to the people who are served by that system and ought to be in control. Now, that's a little bit of a scary idea, and I want to dig a little deeper into it and its heritage. I want to go back to the work of Elliot Friedson. Elliot Friedson was probably one of the most important social scientists, sociologists in the United States in the mid and late 20th century. He worked in New York and many disciplines, but he became fascinated with healthcare and with the nature of professions overall. He chose healthcare as his prime example of a profession. And he wrote a book, in fact, called Profession of Medicine, which was his effort to understand the sociology of the medical world. Now, the book was written, I don't know, maybe about 1970, but it's still worth reading, Profession of Medicine. And in that book, Friedson has a line that I've never forgotten since the minute I read it. He says, a profession, in medicine as an example, is a work group that reserves to itself the right to judge the quality of its own work. In that made-up story about the hotel, all the components of that hotel were reserving to themselves the right to judge the quality of the way they were serving. This is how you have to dress. This is how you have to eat here. This is whether your loved one can be with you or not. The power was in the hands of the hotel. Well, that doesn't work. That's a hotel that's going to fail. In most segments of our economy, the producer doesn't retain the right to judge the quality of what they do. The customer does, the person using that service, and smart, successful, generous, important parts of the economy, like hotels and other things that serve us, better keep in mind that the judge of quality is the person using or co-producing the service in mind. Now, Friedson claimed that wasn't true. A profession, he said, is a work group that reserves to itself the right to judge the quality of its own work. And Friedson, a sociologist, said, well, how could that be? Why would society willingly agree to cede to the producer the right to judge quality? We don't do that with hotels. And he ended up saying, well, that's because of a social contract, a latent, unspoken social contract between the professional and the person the professional is helping. And he said that contract has three components: beneficence, technical mastery, and self-regulation. Let me explain that a little more. He said, society says to doctors and hospitals and healthcare, okay, you can judge the quality of what you do. We give you that authority because we believe you to be beneficent. We think you put your interests, our interests, ahead of your own. You're generous. You're oriented toward meeting needs. Technical mastery. Medicine, you have knowledge we, the public, can't have. It's in Latin, it's in Greek. You have to take 4 years of medical school to learn how to use it, and so on. So I don't claim to know. You know, you have knowledge I don't. That's important to me. And then the third component is self-regulation, which means we trust you that when things go awry, when beneficence or not use of knowledge aren't proper, that you will correct it. You'll be self-correcting. And that's the deal, says Friedson. Because of those three assumptions, those three contracts, beneficence, technical mastery, and self-regulation, society says, okay, healthcare, you have the power. We give it to you. That was familiar to me growing up. My father was a doctor in a small town in Connecticut where I grew up, and he was revered there. He was loved. He did everything. He delivered babies, did surgery, had an office on Town Street, worked evening hours all the time. And but he had the control. There was no question about his power and his sense of power. I remember as a 10-year-old child one night at dinner, and the phone rang, and my father picked up the phone, and he listened briefly and scowled, and then he yelled into the phone. He yelled it. He said, "I'm the doctor. You'll get penicillin when I say you get penicillin." And he slammed the phone down. I'm the doctor. You get penicillin when I say you get penicillin. Just like that manager in the hotel says, "No, you eat either tuna fish on white bread or pasta bolognese. And in my case, I choose for you pasta bolognese." It's funny in a hotel, but it's the structure of power in the healthcare system, according to Elliot Friedson. Well, that's not a bad description of the system my father worked in, and not a bad description of the system I was trained in. The power lay in those who gave care, assumed to be beneficent, in control of knowledge, and self-regulating. But then something went wrong. It didn't happen all at once. It happened probably kind of slowly. I will grade it to have happened between the late years of my father's medical practice, the 1960s maybe, and now. And I guess one way I would say it is the social contract got broken. The social contract got broken. Beneficence, well, you can pick up the paper. You look at the avarice, the greed, the constant acquisition of wealth by the healthcare systems of the country, hospitals merging and raising prices, insurance companies taking exorbitant amounts of money right off the top, paying their executives literally tens of millions of dollars. You see the patient safety problems that some of you may have experienced, where patients get injured by correctable mistakes in their care, and boards of trustees don't even know it often, let alone do something about it. The concept that healthcare exists for and only for the benefit of patients and families and communities is put to the lie by the entry of venture capital and private equity, and basically the out of control profit motive, leading to healthcare costs that are way out of control, twice the costs in Switzerland, which has much better results, and continuing to rise without much mitigation or control. Our healthcare system doesn't even ask often how Switzerland does it. They'll claim, "Oh, that's Switzerland, nothing to do with us." But wait a minute. If it can be done to have a healthy population at half our expenditure, shouldn't we be looking into it? No, but beneficence doesn't seem to be in control right now. And I'll tell you what is: money. The second violation had to do with technical mastery. Well, first, we have had now decades of health services research that shows wild variation in clinical practices, insane differences in rates of surgery, use of medicines, failure to adhere to the best knowledge we have in regular promised clinical guidelines. Now, that's a subtle problem, because you don't want to put doctors or nurses or hospitals in handcuffs. If they think, "I need something off the usual pathway," by all means, that's what I want. But if you look at the level of variability in the delivery of care, it's a pretty much nearly sort of random process. A famous paper by researcher Beth McGlynn at the Rand Corporation around the turn of this century showed that if you took a group of, in her case, it was Medicare patients, and you asked the question, what percentage of the care that they should have gotten did they get? The answer was 54%. 46% of the care they should have gotten, they didn't get. So the concept that we're like these scientists who read books and study hard and know the science and bring that science regularly to bear on the well-being of patients, that's not what's going on. We're trying. Most doctors want to do the right thing, but we aren't really practicing in a predictable scientific way reliably. And therefore, we're giving up achievable benefits that could be achieved. The third part of the deal, you'll be self-regulating. No, no. These insurers that are raising costs for patients and pocketing absolutely enormous profits, for example, with very little value added to the system. Nobody's stopping them. There's no uprising of anybody, physicians, governments, anybody to say, no, you can't do that. This is a public good. Medicine's a human right. And you can't create this confusion and this acquisitiveness as a core property. Self-regulating with respect to the cost of medications? Absolutely not. The extraordinary increases all the time in the cost of medicines just because they can raise those prices. The Biden administration deserves a lot of credit because despite the political pushback, they've been able to shepherd through legislation in a very difficult political scene in Washington that finally is providing some breaks on pharmaceutical prices, some more controls on pricing behaviors by insurers, but it's nothing like the size of the problem. So no, if Elliot Friedson were alive, he'd say, wait a minute, the social contract isn't visible. Beneficence is too often apparently missing, but substituted for the search for profit. Technical mastery, it would be reflected in reliable scientific care. And by the way, you and I, in a half a minute, can use ChatGPT or Google to get an answer that the doctor might not know. So the idea that all the knowledge belongs to the physician or nurse, that's not true anymore. In fact, the knowledge about me, my preferences, my background, my response to medicine, I know more than the doctor does. That's not the deal that my father understood. It's not the deal that Friedson was talking about. And self-regulation, we are not a well-regulated industry right now. Now, the reasons are again, many. I will say, as I said a few minutes ago, I think personally that the driving problem is the dominance of the search for profit, the dominance of the stewardship of money and returns to investors now having pretty much taken over the healthcare system. The fifth largest American corporation, the fifth largest of all corporations, not just health corporations, is United Health Group, an insurer who continues to make profits never seen before in its history and in most companies' history, paying its executives in the many millions of dollars and using upcoding, which I won't explain too much about today, but it's a gaming the diagnostic coding system in Medicare, using pre-authorization and denials and other ways to kind of restrict access to care. Some of that can be good, some of it helps, but not at the level currently in place. Hospitals all over the country are merging and consolidating. It is continuing, and they're doing it for one reason, which is to be able to get control of prices in their markets, control against the pressures of, say, United. So we're now in a big finance game, and I think the patient's getting lost. I think at the clinician level, doctors, nurses, technicians, they come to work, almost all of them, almost every day, just wanting to help, but they're now embedded in a context in which the dollar beats the care. I don't know what to do about this. We are down a slippery slope, way down it. And part of it relates to the American political structure in which, because we allow corporations to support political campaigns through this, under the Citizens United ruling of the Supreme Court, big money accumulates big power, which then protects the big money. And so it's a tight loop, a vicious cycle, which prevents entry by more public interested forces. Now, government is there. I ran Medicare and Medicaid, and I saw the good news and some of the hard news. The good news was I was able to go to work every day thinking only about the well-being of 110 million Americans in Medicare and Medicaid. It was a great privilege, and I have become an enormous fan of what government can do on behalf of people. The problem, of course, is that Medicare and Medicaid are agencies run by agencies in federal government, which are subject to political lobbying. And so it's not always a pretty picture when you try to make changes. What can be done? I know only one answer, and that is fight the power with power. We need political mobilization in this country on behalf of patients and families and communities. And by the way, corporations, which are paying a substantial part of the American healthcare bill through benefits to their employees. Now, those benefits, of course, come out of the pockets of the employees in the long run because it's not available for wages. But there's a great mass of American society that forms a culture that should want to change American healthcare to get it back, maybe back to honoring the social contract. Not you have the power to judge the quality of your own work, but we expect and demand that healthcare, a human right, be beneficent, technically perfect, and self-regulating, as it is not able to be right now. To me, it comes down to votes. I wish that weren't the answer. I'd much rather work with a technical answer, which we just all commit to use methods that now would help make us become a healthier society, which would involve investments way outside healthcare, the things that make us well, the status of our children, education systems, workplace improvements, care of elders, infrastructure like food security and housing security and transportation security and criminal justice reform. That's how we would get healthy. But that isn't going to happen without political force. So you and the National Patient Advocate Foundation, you've taken the time to listen to me. I think we have to consider ourselves more and more part of something bigger than ourselves, coming together to insist that our country ought to have a healthcare system that befits our wealth, our stature, our international leadership. We shouldn't be 69th in the world in the healthcare system. We should be first. We should not be 40th in the world in infant mortality or life expectancy. There's no reason we can't be first, and first for everyone, because part of this solution must include the addressing the inequities that have surfaced in this money-hungry system, where we are continuing to exclude communities of color, communities of with low resources, underserved communities, and there will be no solution that doesn't solve that problem. And by the way, if we solve the healthcare needs of the least powerful, the least wealthy among us, we'll be solving it for us all. So I hope you never meet that hotel that I spoke of. And I hope we can move healthcare steadily away from habits of control and power mongering and frankly, greed that have led us astray against the wishes of doctors and nurses and the great workforce we have who want nothing more than help heal, and against the wishes of people like you who want healthcare that they can count on. Thank you very much. It's been a pleasure to get to talk with you.